Assurance activities. This is the A-Team's second presentation on assurance activities as part of our continuing saga. Good health is necessary for life, happiness, and the ability to prosper. Children have a right to good health and health care. The United Nations Convention on the Rights of the Child includes health rights as part of the children's core economic and social rights. In doing so, the CRC follows the example of other human rights conventions and declarations. For example, the International Covenant on Economic, Social, and Cultural Rights and the Universal Declaration of Human Rights that recognize the right to health for all individuals. The United Nations Convention on the Rights of the Child prohibits discrimination and wants each child to have the highest quality health care that can be attained in that area. Regardless of income, all children should be given opportunities to be well-nourished, healthy, and safe. In the United States, there are no laws that state a child has a right to health care, but there are programs in place that imply that children have a right to health care through the Affordable Care Act, SCIP, National School Lunch Program, and WIC. These programs indicate that children are supported and that they have a right to health care. Children should be given every opportunity to lead a healthy life. In children's health care, there are many unmet needs that need to be addressed. The field of public health has long recognized the relationship between socioeconomic status and other social determinants and health, and delineates this relationship is reciprocal. Poverty detracts from resources used to maintain health, and poor health detracts from the educational and employment paths to improving income. Although substantial gains in meeting some of the Healthy People 2020 objectives have been made in recent years, relatively little progress has been made in other important indices, especially in health disparities. The progress needs to improve. Supporting those who work in pediatric healthcare is an important step in helping communities with child health initiatives. Giving pediatricians opportunities to support communities through education and advocacy, children will have better access to health care. Specialized medicine is needed to treat the many aspects of children's health that are now commonplace, such as chronic diseases and social issues that arise from living in poverty. Having the support of healthcare professionals will allow parents to know that they are working towards better futures for their children. It is important to assure competent public and personal healthcare workforce. This could be done by displaying credentials in the healthcare facility of each and every provider. Health Resources and Services Administration actively works to improve access to health services by training and placing healthcare providers like nurses where they are needed. Nurses have the ability to address issues that can impact a child's health. Nurses have a good understanding of the health needs of the individuals, families, and communities with whom they have regular contact. Community nurses have an even better understanding of not only health needs but other social and environmental issues which have a direct impact on health, such as housing, pollution, access to open space, income, benefits, education, etc. When pediatricians and nurses take a more active role in public health, the children in the community are the ones who gain a better team to help them grow and thrive. Redefining children's health means expanding what is normally thought of when treating children. Looking into behaviors, social and physical environments, and biological background can help determine their health trajectories. Looking at all aspects of a child's life will determine where more help is needed and get the parents more involved in helping them lead healthy lives. All areas must be evaluated. Evaluation is crucial to determine if the goals are on target for being met. By providing a child with some type of coverage, they will be able to seek care and be seen by physicians for the proper health attention they need. There is no perfect solution or crystal ball to predict what the future holds for children. When it comes to children, there should be a precedence. This comes from a moral standpoint and an ethical one. People cannot always help their circumstances, but society as a whole can do everything in their power to care for the children. To look out for them, society should take an open arms approach. There should be policy developed that is like the No Child Left Behind, such as no child should be subjected to impoverished conditions. The disparity in this country is too great between the rich and the poor. The Affordable Care Act and the other programs are a start, but there is much more that can be done. Assurance is in the works, but is not complete. All children should be given equal opportunity to be healthy, safe, and well-nourished. Children's futures are at stake, and we have a long way to go to ensure every child has a secure, healthy future. This is the end of the second presentation, and these are the references.